Hello everyone, good afternoon everybody. I am Anaaya from Bladder Wellness team. I am sure all of you must be keeping good health. Please vaccinate yourself and do wear mask when in public places. OAB is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. Let's unite to raise awareness about incontinence related issues and its impact in the life of people living in it. To throw more light on this subject and guide us on what's right for diagnosis and treatment of OAB, today we have with us renowned doctor, Dr. Gaurav Sharma. Dr. Gaurav Sharma is a senior consultant urologist from Agra. Dr. Gaurav Sharma is having rich experience in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. Over to you, Dr. Gaurav Sharma. Thank you so much for joining, Doctor.
Hello.
Hello, welcome, Doctor.
Uh, Good afternoon. Good afternoon to all.
So,
Kindly
doc-
start. What are all the questions?
yes. So, Doctor, first of all, let us know what is overactive bladder means OAB.
Overactive bladder means it's a excessive activity of the bladder due to some means irritant which are irritant to the bladder. Which things irritate the bladder. So it's a increased activity or excessive activity of the bladder. So which results in the increased frequency of the urination, urgency, and pain. So the urgency is the component of this overactive bladder which disturbs the patient most.
Okay, sir. Sir, what is the major symptoms of OAB?
Yeah, these three main symptoms are of the OAB: the frequency, urgency, and the pain, the suprapubic pain. Okay, and most important and most disturbing is urgency. Urgency should be there to diagnose or to conclude that the patient having the OAB disease.
Mhm. Okay, sir. Sir, what are the causes of OAB? Means, why does it
OAB,
happen?
yeah. Uh, uh, this overactive bladder means so by the definition it's explained itself like it's overactivity of the bladder. So there are several causes of this condition. It's usually common in the female patients as compared to the male, and some causes are the idiopathic or some causes are psychotic disorders, and mostly causes are dietary involvement of some dietary products which irritates bladder, means excessive intake of the caffeine, excessive intake of the tea, excessive intake of the soda containing liquids, and uh, and some diseases also conclude that patient may develop the OAB symptoms, like some patients having a distal obstruction to the flow of the urine. So in such conditions, it eventually leads to the overactive bladder. So
Okay,
these are
okay.
the main causes of the
Causes.
overactive bladder.
Okay. Sir, is there any age limit, of having OAB or anyone can have OAB?
No age limit is there. It's commonly seen in the 30 to 50 years of age, usually in the female. It is
Mhm.
a common age.
Okay. And sir, if we talk about the treatment options for OAB, so what are the various treatment options for OAB?
First, we have to diagnose the patient with the OAB. Means first, we have to uh, see what are the patients having the symptoms, like which I described earlier, the frequency, urgency, and pain. So urgency should be must, should be present in the patient symptoms, and so we have to do some investigations for these symptoms, means which includes the ultrasound of the kidney, ureter, bladder, and the post-void residual urine, and the urine routine and urine culture to exclude if there is some infection or not in the urine, and some investigations like uroflowmetry. So we have to see the flow of the urine, whether it is obstructive flow or it's a normal flow. So if all the studies, all the investigations became normal and the patient having persistently having these symptoms, then we can conclude that patient having a overactive bladder. So in such cases, we have to take history from the patient. That some what are the what are the dietary habits of the patient, whether the patient and taking the excessive caffeine, excessive coffee, excessive tea or soda containing liquids mostly, and symptoms, and what are the means range, and what are the duration of the symptoms you have to see. In such cases, the patient having these symptoms for long time, means patient having these symptoms from 1 year, 2 year, and taking medication from here and there, and not having a relief with the medications. So these are the investigations to conclude the patient having overactive bladder. And we start the medication initially. We have to give reassurance to the patient, and we have to teach the patient that you have an overactive bladder. So most important thing is you have to make some dietary modifications in your life and some lifestyle. Means excessive weight of the patient also lead to the some symptoms of the overactive bladder. So lifestyle modification and dietary modification includes to reduce weight, to do exercise daily, and what I told earlier, that some dietary products having a uh, increased chance of the that it make the patient overactive, means excessive coffee, excessive caffeine, excessive
Mm-hmm.
tea, soda containing liquid, some fruits like spinach, and excessive chocolates, nuts. These are the foods which we have to avoid in the overactive bladder, and we have to also make the means we have to also modify the time limit of the taking the liquid food. Means patient can take liquid food up to 6 o'clock. It's okay.
Mm-hmm.
Patient take excessive liquids after 6 o'clock. We have to limit the excessive liquid foods. Means from 6 to 9 a.m. Patient take only liquids if it is required, and before sleep patient avoid liquid food before 2 hours before sleep. So these are the modifications in the diet and the lifestyle. Other we can initially we can try the anticholinergic drugs like sulfasalazine, and other drugs like mirabagrone. Nowadays, beta-3 agonist mirabagrone are commonly used in this overactive bladder. So we have to start the medication in the lowest dose, that 25 milligram once a day. It's all depend on the dose, depends on the patient symptoms and patient having incontinence or not. If the patient having incontinence means the symptoms are more, so we have to start with the higher.
Okay. Okay, sir. So now we have some questions from our viewers, our audience. Shivendra
Yeah.
Singh is asking, sir, if someone is leaking urine during laughing or sneezing, is this belongs to OAB?
Yeah, it might be a one component of the OAB. Means someone leaks during the laughing, coughing, or speaking loudly, then it's conclude that the patient having a incontinence. It is a stress incontinence. When the stress in the abdomen increases, means pressure in the abdomen increases, the patient leaks. So we have to look in this condition. We have to look the patient previous history. Means patient having a excessive history of any major surgery before, means it is related to the weakness of the pelvic floor muscles. So we have to see what is the cause of the weakness. So in this condition also the treatment is same. We have to give the patient the advice, the dietary and lifestyle modification, and the same drug. So we have to make the bladder dry. So we have to first in such cases we have to first search what is the causes of the pelvic floor muscle weakness, and advise accordingly.
Okay, okay. Thank you so much, sir. Shivendra Singh, I hope you got your answer. Sir, there are more questions. Adi Singh is asking, sir, if OAB is a genetic problem.
Not as a genetic, but some cases are seen. Means actually what happened in any disease, if there is a it is a percentage wise collaboration. Na? Means there is 2 to 3% cases are seen in the genetic also. The mother having a OAB, then daughter or son might have the OAB. Na? So some cases are there, but not it's in the majority part.
Okay.
It's minority cases are seen.
Okay, sir. Sir, Neha Singh is a viewer and she's asking, sir, क्या OAB एक खतरनाक बीमारी है जिसे आगे जाकर प्रॉब्लम हो सकती है?
No, it's not खतरनाक खतरनाक नहीं है, लेकिन we have to diagnose earlier to prevent many complications. So any disease having a complication if not treated at a time, okay, at an accurate time or at a correct time. So we have to diagnose earlier. The patient having these symptoms, please consult a urologist, please consult a physician to what she's having, what she diagnosed means. So we have to diagnose these conditions earlier. Otherwise, many conditions having a complication. So this disease is also having a complications later.
Right.
So
So
early
they have.
diagnosis, early treatment is the method to prevent the complications.
So they have to consult their nearest urologist. That
Yeah,
is the
yeah.
most important thing. Sir, there is more questions. Akash Singh is asking ki, what is the most effective treatment for BPH?
Effective treatment for BPH.
Yes.
Okay, BPH is benign prostatic hyperplasia. So we have to look for the first we have to look the what are the symptoms of the patients. Means BPH having a always BPH having a medical and surgical management. So for medical management there is some indications. For surgical management there is some indications. So the patient having a mild to moderate symptoms of the BPH, there is a score of that. So we have to meet the patient and ask the patient the symptoms and score the symptom score according to the symptoms of the patient. In mild to moderate symptoms, we start the medications. And if there is no any direct indication for surgery, okay? Then in severe symptoms, the medications works very less and very less effectively. And some indications are there to directly go for the surgery. Means patient having a bladder stone due to the prostate enlargement, if the patient having a recurrent hematuria, if the patient having recurrent urinary tract infection, if the patient having a upper tract changes when there is a hydroureter nephrosis of the bilateral kidneys. So these are the indications for surgery. And if the patient already taking medications and for 1 year or 2 years, for 6 months, consider 6 months. If there is no improvement in the patient's symptoms, then it's a indication for doing surgery for the BPH.
Okay. Okay. Sir, there is one more question from Deepak Upadhyay. He is asking, does OAB lead to UTI?
Yeah, OAB not lead to the UTI. Sometimes UTI lead to the overactive bladder symptoms.
Okay. Okay.
Okay.
Mm-hmm.
It's vice versa.
It's
Sometimes.
vice versa. Mm-hmm. Sir, Sonia Sahu is there and she's asking what medications should be avoided with BPH?
In BPH, means medication not avoided, means some medications are there. We have to make the timetable of the medication or change the timing of the medication. Mostly the BPH patients having, they are old patients. So around 50-60% patients having a hypertension at that age. So some patients are taking hypertensive patients. They are taking mostly the patients are taking diuretics. So in these patients, we have to change the time of these drugs. Means diuretics, we have to change these timing. So most of the patients are taking diuretics in the evening hours. So we have to change instead of evening, patients should take these drugs in the morning hours. So it can avoid the increased frequency of the urination.
Okay, sir. Sir, our next question is from Radha Krishnan. Are there any other lifestyle steps to take in order to manage OAB?
What? Pardon?
Are there any other lifestyle steps? He's asking, are there any
Yeah.
other lifestyle steps?
Lifestyle changes I already told. We have to, if the patient is obese, so we have to make ask the patient to reduce the weight, daily exercises, daily yoga, and so it can help to decrease the symptoms. And other lifestyle, I already told that we have to make a timetable of the taking food. Means uh, in the morning hours, breakfast should be at earlier, 8 o'clock, 9 o'clock. After that, we have to divide the lunch into two timings. Not eat frequently, but in less quantity. So make the divide the lunch in the two times. Like that, divide the dinner also in the two times. So after 2 to 3 hours, we have to take something in small amount. So this is the timing of the food. Another, what I told, caffeine containing food, soda containing food, and excessive tea, excessive coffee, excessive chocolates, nuts, spinach. These are the foods which elevates the symptoms of the OAB. So we have to decrease the quantity of this.
Okay, sir. There is one more question from Manoharan. He's
Yeah.
asking, during COVID, how do we manage the do's and don'ts for in managing OAB? During vaccine, any medicine need to be stopped?
No. Nothing. There is no contraindication of these drugs due to vaccination, and there is no interaction with the vaccination of these drugs. So it can be continued with vaccine also.
Yes. So please, everyone, get vaccinated because that is important. Sir, so what should a patient do to reduce symptoms of OAB?
Yeah. First, we have to evaluate the patient. What are the means frequency of these symptoms, and what is the how much it disturbs the lifestyle of the patient. If these symptoms are disturbing more rigorously of the patient lifestyle, then you have to start with the lifestyle modification, dietary modification, and some drugs. And ask the patient to we have to give some drugs for 2 weeks, and ask the patient to describe it is decreasing, symptoms are decreasing or not, or remain same. Then we have to progressively we increase the dose of the drug.
Okay, sir. Sir, what should patient do if he or she thinks of having OAB?
What? Pardon?
What should patient do if she or he thinks that they must be having?
Yeah. So first, patient should understand that what are the symptoms which may lead to the OAB, or which may the patient having a OAB with that symptom. So I already told the increased frequency means increased time of times of the menstruation in a day, and urgency. Main thing is urgency. If the patient is having a OAB, then urgency should be must. Urgency should also be there. And another thing is pain, the suprapubic pain, which relates that in the lower part of the abdomen, patient having a constant dull aching pain. So these three are the main symptoms. Other symptoms are sometimes patient having an urgency, and it leads to the incontinence, means leakage of the urine. When the patient felt that she or he has to go bathroom for toilet, and in the way to the bathroom it leaks. So it is incontinence. Sometimes some patients have incontinence also. So these symptoms combinedly if the patient has, then he or he should visit the urologist for the further evaluation.
Yes. Sir, there's a question. What are the most troublesome symptoms of OAB?
It's urgency.
Urgency of like urinating again and again.
Yeah, urinating again and again.
That is important. So I think you have to go to your nearby urologist if you are like urinating again and again, because that is important. Sir, any takeaway message for our viewers who are listening to us, who are seeing us right now?
Yeah, actually, for any disease, early investigation, early diagnosis of the disease, and early treatment is the main goal to prevent the further complications and make the patient healthy. So, if patients having any urinary related complaints, don't hide. Okay, always go to a doctor, go to the urologist, and explain everything and say everything about your disease. So it may lead to the early diagnosis and early treatment of the disease, which prevent the further major disease or complication associated with that. So it always relates the healthy life of the patient.
Thank you. Thank you so much, Doctor, for your valuable time. And it has been quite an informative session for our viewers. And we look forward for many more such sessions in coming time. And thank you, viewers, for an excellent participation. And for more information on how to diagnose, manage, and treat overactive bladder, for more information and updates on the overactive bladder, stay connected on our Facebook page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you and good day to all. Thank you so much, Doctor.
Thank you very much. Thank you to all.